Occasionally, many of us face difficulty falling asleep, but fortunately, this usually resolves within a short time. However, when the problem continues, it can turn into a disorder that significantly affects overall well-being. Among the many sleep disorders, one of the most common is sleep apnea, where obesity plays a major role as a risk factor.
Hi, I'm Dr. Nisa Nabila and you're watching My Body, My Life.
Sleep apnea is estimated to affect 1/7 of the adult population globally, which translates to approximately 1 billion people. Over the last 4 decades, the growing prevalence of obesity worldwide has played a significant role in the rise of sleep apnea disorders. Similarly, in our country, the incidence of sleep apnea has surged in tandem with obesity, with around 15 to 30% of the local population affected by this condition. Sleep apnea is a serious disorder that can lead to various physical health complications and, importantly, also negatively affect mental well-being. Research indicates that persistent sleep apnea can trigger psychological symptoms such as depression and anxiety.
Sleep apnea is actually when we stop breathing while we are sleeping. Any period of more than 10 seconds where we stop breathing is considered a significant event. So when we stop breathing when we are sleeping, the blood oxygen level falls and our brain is stimulated to wake us up. So when we wake up, we start breathing again and then we resume sleeping. So this is what is known as sleep apnea.
Medical terminology, apnea means a cessation of airflow. In other words, someone who stopped breathing for a short period of time. And when that happens during sleep, this is called as sleep apnea. And why do people get sleep apnea? This is because some patients who are at high risk for sleep apnea, for example, they are obese, they have excessive tissues in their neck, their airways collapses during sleep. And why does that happen? It's because their muscles becomes very relaxed.
As we age, our sleeping patterns change, and even so, our sleeping needs become more unique. And I'm sure most of you have had trouble sleeping and even waking up in the middle of the night. It is crucial for us to know if this is a one-time thing or is it a bigger issue. It is best to understand what is sleep apnea, but first, let us learn regarding the sleep cycle of our body.
Our sleep cycle has got many components. So it's usually divided into 3 parts. Stage 1 is our light sleep, which is about 5% of our sleep time. Stage 2 is a deeper sleep, which is about 30% to 45%. And then stage 3 is when we have slow wave sleep, where it is a really deep sleep.
So the next stage will be REM stage. So this is called rapid eye movement. So rapid eye movement is, in other words, is called a dreaming stage. Yeah. So how do you know that someone is dreaming? So maybe you can just observe that they move their eyeballs underneath their eyelids. So, but of course, when we do a sleep study, we could actually see specific what they call fibrillations that we can see from the EEG that states that this patient is in REM stage. And a lot of diseases, especially sleep-related diseases, occurs during REM. For example, periodic leg movement in sleep, for example, bruxism and so on. But obstructive sleep apnea actually can occur in both REM as well as a non-rapid eye movement.
Generally, a person's sleep cycle passes through several stages, which repeat throughout the sleep duration. The first stage, light sleep, involves a partial state of consciousness, often referred to as dozing, where the person can be easily awakened. The second stage, deeper sleep, means the person is asleep, with their breathing and heart rate becoming more regular, although they can still react to their environment. The third stage, slow wave sleep, is deep sleep, where awareness is significantly reduced, making it very difficult to wake the person. After these stages, the sleep cycle transitions into the final stage, known as REM, rapid eye movement, where the eyes move rapidly in various directions. Dreams typically occur during the REM phase. Despite the minimal level of consciousness, the brain remains extremely active during this phase.
So as someone falls into the sleep, so when the patient experiences a condition called sleep apnea, when the jaw and the tongue falls backwards and obstruct the airway, so there will be lack of oxygen supply. So the heart has to pump harder to supply the oxygen. Somehow the brain has a defense mechanism whereby the brain will send a stimulus so that the patient is awake and resume breathing.
So this actually wakes us up and creates fragmented sleep or disturbed sleep. If we have more apneic episodes, then we will end up waking up more times in the night, and this creates fragmented sleep, and a person will wake up feeling more tired, and the severity will be worse.
Not only that, lack of oxygen supply will have deleterious effect to other organs of the body.
Sleep apnea is characterized by intermittent breathing pauses during sleep. Our brain continuously monitors the body's status, making the necessary adjustments to heart rate, blood pressure, and breathing. When breathing stops, either due to apnea or hypopnea, the oxygen levels in the blood can decrease. Apnea refers to the cessation of breathing or a near complete lack of airflow during sleep. Hypopnea, on the other hand, refers to shallow breathing, where the breathing is inadequate to maintain oxygen levels in the blood. The brain responds to the drop in oxygen levels, whether from apnea or hypopnea, by triggering a reflex that wakes us just enough to resume breathing. Once breathing resumes, the brain automatically tries to reconnect the interrupted sleep cycle. As sleep apnea becomes more severe, these disruptions become more frequent.
Selepas saya mendapat rawatan di Hospital Pusat Perawatan Universiti Malaya dan melalui ujian tidur selama 8 jam di sana, dan selepas beberapa minggu keputusan keluar, doktor mengesahkan saya mengidap penyakit sleep apnea.
Obstructive sleep apnea is the most common type of sleep apnea worldwide, including in Malaysia. A major symptom of this condition is loud snoring during sleep. According to a study conducted within the country's population, around 47.3% of respondents between the ages of 30 and 70 report snoring every night.
Sounds familiar, huh? But it's worth checking if OSA is the case. Better late than never.
So there are three main types of sleep apnea. So number one is actually obstructive sleep apnea. The second is called central sleep apnea, and the third is called complex sleep apnea, where there's a mixture of both obstructive and central.
In obstructive sleep apnea, we have a restriction of airflow through the upper airways. So when we say upper airways, we actually mean through the nasal passage, through your nose, or through your mouth.
So this is actually mainly caused because of the obesity and then excessive tissues around the neck where obstruct the airway. So when that happen, when obstruction occurs in the airway, the abdominal and the respiratory muscles and the chest muscles actually try to work harder to overcome this obstruction.
In central apnea, this is mainly due to the brain. The brain is not sending signals to our respiratory muscles to expand, and this can be seen in strokes, brainstem injury, people who go to high altitude suddenly, in certain conditions like Lou Gehrig syndrome. Then we have the central type of apneas.
The third stage will be complex sleep apnea, where there's a mixture of both obstructive and as well as central sleep apnea. In certain situations where someone suffers from severe sleep apnea may develop a mixed sleep apnea, where there's a mixture of both. Again, the treatment might slightly differ between these two.
In adults, the commonest symptom that brings patients to see us is snoring. Snoring noted by partners or friends of the patient. Then they can also experience tiredness, frequently waking up with headaches, feeling like they cannot remember, heaviness of the head.
Why do they get morning headache? It is because of build-up of carbon dioxide as a result of hypoventilation at night. Or morning headache can also be because of poor sleep quality the night before. Dry mouth. Basically, dry mouth is because of during the night time they have frequent gasping for air. Okay, or they are mouth breathers, so they get dry mouths in the morning. Choking sensation, especially in the middle of the night, that's also another common symptoms of sleep apnea.
The patient can also experience being told by family members that they stopped breathing in the night, and it worried them. They had to be woken up, or they themselves will remember waking up choking and then going back to sleep again. So these are the common symptoms in adults.
There are many similarities between the symptoms of obstructive sleep apnea and central sleep apnea, which can sometimes make it challenging to accurately identify them. Common symptoms include extreme fatigue, even after a full night's sleep, loud snoring during sleep, persistent daytime sleepiness, cognitive impairment, leading to complications such as memory loss and difficulty focusing, waking up multiple times during the night with shortness of breath, intermittent breathing pauses during sleep, difficulty staying asleep, or insomnia, sweating and restlessness at night, morning headaches, especially upon waking, mood changes, including depression and anxiety.
Having sleep apnea will bring a lot of complication, not only to the physical health, but definitely to the mental health as well. Imagining yourself having sleep deprivation, even not long, even for one day, how will you feel? We would feel very tired, fatigued, and we found ourselves very difficult to focus while driving or even at work. Hence, we can develop irritable mood and also mood swing. And over time, when the productivity very much affected, then people with sleep apnea is prone to have depression.
So as we know that sleep apnea, treatment of sleep apnea requires holistic approach. Not only we have to tackle the complications of the disease, but we also need to take care of their mental health. So this will need a multi-modality treatment approach from various individuals.
Sleep apnea does not just affect adults, it can also affect children. It can mess with the cognitive function of the brain, memory for adults, and the learning curve in children. But keep in mind, the symptoms may differ between adults and children.
In children, it's slightly different. They may also have snoring, but sometimes it is noticed that they have hyperactivity, which can be diagnosed by some people as attention deficit syndrome, difficulty concentrating in the morning, failure to do well in school. When they are sleeping, they are constantly restless, moving around. There can be bedwetting episodes. Sometimes when they sleep with their neck extended up like that because they are trying to be able to breathe. So they might also experience some night sweats.
And mainly children who suffers from sleep apnea is because of certain factors. For example, they have a huge tonsil, so tonsil grade 3 or grade 4, whether they have adenoid hypertrophy and so on. So those are the children that might need an ENT assessment whether they need surgery to treat the sleep apnea or not. Some children, they have actually small chin. They have a syndrome called Prader-Willi syndrome. That is also predisposed some children to get sleep apnea.
Here are some of the symptoms of sleep apnea in children that should be given attention. Symptoms resembling ADHD, such as hyperactivity, poor focus, or underperforming in learning, frequent bedwetting, repeated movements of hands or feet during sleep, unusual sleep positions, acid reflux, or heartburn.
Obesity directly impacts sleep apnea in a few ways. Number one, we see it more in men. In men, we also notice especially the weight gain in the neck. So a large neck circumference, usually more than 17 inches, or ladies more than 15 inches, it significantly impacts because you have the extra padding of fat, which when you inspire, which is taking a deep breath, there is collapsing of the muscles, which further narrows our airway and contributes to a lack of oxygen in our body, which then triggers the apneic episodes.
But basically, in the medical literature, we do have a questionnaire called Stop Bang questionnaire. So each alphabet actually carries a meaning and carries a point. So if the point is beyond 3 and above, it indicates that that patient has high risk of sleep apnea. So what is Stop Bang questionnaire? S stands for snoring. So if you have snoring, that's 1 point. T is tiredness during daytime. O is observed apnea, so your partner might notice that you actually stop breathing for a few seconds in the middle of the night. P stands for pressure, blood pressure. If you have high blood pressure, okay, that indicates that is a risk factor for sleep apnea, but it's also a complication of sleep apnea, so it is like a vicious cycle, hypertension. B is your body mass index. So if your BMI is beyond 35 kilogram per meter squared, that carries 1 point. A, age. As we grow older, the higher the chances that we suffer from sleep apnea. Age more than 55 carries another point. N stands for neck circumference more than 40 centimeter. And G is gender, male gender. So if you have a scoring of 3 and above, you are at high risk to get sleep apnea.
Sleep apnea can affect anyone, but several factors can increase the risk. Some of these factors are obesity. Excess body fat can interfere with the smooth flow of breathing. Large neck circumference. Individuals with thicker necks are more likely to have narrower airways. Male gender. Men are 2 to 3 times more likely to suffer from sleep apnea than women. Increasing age. Sleep apnea occurs more frequently among older individuals. Family history. Having a family member with a history of sleep apnea increases the risk of developing it. Smoking, alcohol consumption, and the use of sedatives or tranquilizers.
Setelah mendapat putusan daripada sleep study itulah, dia merasakan saya pernafasan terhenti ketika tidur tu selama 8 jam tu lebih kurang 365 kali jantung berhenti dalam masa 3 second.
Sleep apnea is a serious condition, should not be ignored. If left untreated, it can become a major serious health issue, even life-threatening. Some studies show that people with sleep apnea are twice more likely to experience sudden death compared to those without it. So, do not snooze on it, get checked and sleep safe.
So you would imagine that once obstructions occur to the airway, there is actually lack of oxygen supply, right, to the lungs and to the heart. So the heart needs to overcome this by pumping it harder. So over time, the heart will actually enlarge This is called dilated cardiomyopathy, and with time, the patient can suffer from heart failure. So that's one of the complications.
When you are having sleep apnea, it can cause your blood vessels to be less flexible. So it becomes a little bit harder. The blood flow is going through a lot of resistance, which increases the pressure. So thereby, that's how you get high blood pressure.
Sleep apnea can lead to a wide range of health complications, many of which pose serious risks. When sleep is frequently disrupted at night, it often results in fatigue and excessive drowsiness during the day. This makes individuals with sleep apnea more likely to experience accidents, whether on the road or at work. Disturbed sleep can also cause significant mood changes, leading to increased irritability or even depression. A sudden drop in oxygen levels during apnea episodes can trigger high blood pressure. This further raises the risk of heart attacks, strokes, and irregular heart rhythms. In some cases, sleep apnea can contribute to insulin resistance and type 2 diabetes. People with sleep apnea are also at greater risk of complications after major surgeries due to potential breathing difficulties.
We go by stages. We go from the history. Okay, I do ask them about the stop bank questionnaire. If their stop bank is 3 and above, that indicates that this patient has high risk to get sleep apnea. I do ask them about the Epworth sleepiness score, how sleepy they are during the daytime. If the score is more than 10, again, that is actually a high risk for sleep apnea and so on.
So what we as ENT surgeons do is we have what we call an endoscope, and we will take a look at the structure of the patient's nose. Is there any restriction in their nose for the air to flow? Is there any restriction in their mouth, such as large tonsils, the size of the tongue, what their soft palate looks like, the uvula length, and then we can even see beyond the tongue where their vocal cords are, and we can see if there's any growths or tumors there that may be restricting the flow of air into their lungs.
Besides home sleep tests, the most common diagnosis for sleep apnea is nocturnal polysomnography, performed overnight in a medical facility. The severity of sleep apnea is determined by the Apnea-Hypopnea Index, AHI, which measures the average number of apnea or hypopnea events per hour. An AHI between 5 and 15, representing 5 to 15 instances of breathing cessation per hour, indicates mild sleep apnea. An AHI between 15 and 29 indicates moderate sleep apnea, while an AHI of 30 or more suggests severe or critical sleep apnea.
Treatment of sleep apnea is actually a multi-modality approach. Okay, it starts from lifestyle modification. As we know that obesity is associated with sleep apnea, one of the treatment is actually weight reduction. A 10% decrease in your body weight actually carries a significant decrease in your apneic-hypopneic index.
Aside from weight loss, we opt for conservative measures first where possible. We will also have a look at their nasal structure. If they have things like allergies, we will control the allergies. We may give them medication like nasal sprays, antihistamines. If they have issues like high blood pressure, diabetes, we will refer to our colleagues to control those issues. However, if there are things like large tonsils, which are very obvious and causing the patient a lot of problems, then we will probably advocate surgical means.
A healthy lifestyle and proper sleep habits are vital for managing and reducing sleep apnea. Here are some tips to practice daily. A healthy diet, rich in fruits, vegetables, and whole grains, can help reduce sleep apnea symptoms. Regular physical activity helps control body weight and improve sleep quality every night. Stick to a regular sleep schedule and ensure the bedroom is dark, comfortable, and quiet for optimal sleep. Elevate your head and sleep on your side. Avoid sleeping on your back as it can narrow or block the airway. Avoid electronic devices near bedtime. Stay away from smoking, alcohol, and sedatives as they can worsen sleep apnea symptoms. Foster a positive mindset and consult a psychologist if experiencing symptoms of depression or anxiety.
Beza dia amat ketara juga. Kalau sebelum tu, kalau saya tak pakai seatbelt tu, saya tak tahulah sama ada pernafasan terhenti ke kan. Pagi tu saya kadang-kadang kepala saya sakit, kadang-kadang masa saya tengah drive, tengah buat kerja, mengantuk. Selepas saya pakai mesin seatbelt tu, keadaan saya segar, lain daripada sebelum yang saya tak pakai seatbelt.
For some, sleep apnea can evolve into a lifelong chronic sleep disorder. That's why it's crucial to foster awareness of the importance of maintaining a healthy lifestyle for both ourselves and our loved ones.
A healthy body nurtures a healthy mind. I'm Dr. Nisa Nabila, and thank you for watching My Body, My Life.